Lesson 6. First aid. First aid is the initial assistance or treatment given to a person who is injured or suddenly becomes ill. The person who provides this help may be a first aider, a first responder, a policeman or fireman, or a paramedic or EMT. Example of first aid. Always attempt to seek professional medical help for injured person. First responder are not always ready, available during emergency situation, and is that case, do your best here provided what treatment you can until help arrive. But never forget the serious injuries. Always required more advanced treatment, and you should do your best to get the injured person to professional caregiver. 2. What is a first aider? A first aider is a person who takes action while taking care to keep everyone involved safe and to cause to further harm while doing so. Example, ang papel na ginagampanan ng isang unang tagapagtulong ay unang magbibigay ng agarang nagliligtas ng buhay. Pangangalaga ang medical bago ang pagdating ng karagdagang tulong medical. Maaaring isama dito pagsasagawa ng mga pamamaraan tulad ng paglalagay ng isang walang malay na nasawi sa posisyon ng pagbawi. Pag nasagawa na ang cardiopulmonary resuscitation or CPR. 3. First aid priorities. Assess a situation quickly and clean. Protect yourself and any casualties from danger. Never put yourself at risk. Prevent cross-contamination between yourself and their casualty as best as possible. Comfort and reassure casualties. Access the casualty identified as best you can the injury or nature of illness affecting as casualty. Giving early treatment and treating the casualties with the most serious life-threatening condition first. Arrange for appropriate help. Call 911 for emergency help if you suspect serious injury or illness. Take preserves life, prevent deterioration, promote recovery, immediately action. 4. The step below should be observed when approaching a casualty. Assessment. A. Screen survey. Primary survey, safety person, protection, accident mechanism. B. Casualty survey. Airway, breathing, circulation, stability, exposure. Number 1. Identity and immediate potential danger. Number 2. Call for help. Number 3. Check for response. Number 4. Check the casualty airway. Number 5. Check the casualty breathing. And number 6. Check the casualty circulation related resources. Additional first aid as a situation required for all emergency cares including first aid. Providers should persevere the screen to assess for. Example, bilang unang tagapagtugon sa anumang sitwasyon, dapat mo munang unahin ang manatili ang buhay. Maaring ikailanman mo masasagawa ng CPR, ihinto ang pagdudurgo o gumawa ng ibang pangpagkilos upang mampantili ang buhay ng biktima. Magsisimula sa sirkulasyon, daan ng hangin at pahinga. 5. Safety. First aid providers must be aware of their personal safety and take universal precaution that will vary based on specific circumstances. Example, ito ang tanging dahilan kung bakit mahalaga na lumikha ng isang ligtas na kapaligiran sa pagtatrabaho. Sa mga panahong ito, ang mga pamamaraan sa kalusugan at kaligtasan sa lugar ng trabaho ay mahalaga para sa ikakabuti ng kapwa, mga empleyado at mga employer, sapagkat ang pagkakawala ng tao ay hindi masusukat at hindi matiis, tulad na ang masasabing pagkakawala o pinsala.
Environment. In certain instances, the surrounding may not be safe due to electric cables, fire, risk of explosion, dangerous goods, or the casual may be in unsafe location, such as in a near water or ice. Safety environment is more than being safe. It makes safe our lives in any aspect. You cannot enjoy your work or you cannot be where your goal plan if there is no so many hazards and rest around you. Environment plays important roles in healthy living and the existence of life on planet Earth. We should use safety for our environment and surroundings. Any risk can make us harm, so we should be aware of for using proper tools and proper PPE when working. Any unsafe location may dangerous and can even put you to death. Casualty. The casualty may be aggressive to alcohol or drugs. So, sa number dito, pwede maging ang alcohol or drugs. So, paano pag sobrang paggamit ng alcohol, so ang daming na-accident. Ito mo yung nababalitaan mo sa TV o sa radyo na na-accident dahil sa sobrang paggamit ng alcohol or sobrang paggamit ng drugs. Number 2, there might be a risk of infection due to contact with body fluid. So, ang halimbawa nito ay yung sa nag-iinuman or sa nag-drink, kadalasan po ay gumagamit sa isang baso. Halimbawa, kung merong virus ang isang tao tapos ginagamit din sa isang or halimbawa may sipon ang isang tao, kainuman niya, tapos yun din ang ginamit niyang baso, yun ang infection palipat-lipat. So, ang nagiging mangyayari nito ay mahawaan siya kung ano man ang meron yung taong yun. The common mnemonic is A, B, C, or D. D, E. A means airway. So, example natin ulit yung aksidente sa kalsada. May aksidente sa kalsada, so agad natin ang maisip natin? Yung first aid. So, anong unahin natin? Titingnan natin yung pasyente or titingnan natin yung nadisgrasya kung may hangin pa ba. Also, natin yung ilong, titingnan natin yung butas ng ilong kung merong hangin na dumadaan. Ito yung labas, dito mo malalaman kung meron siyang hangin na lumalabas. So, ang letrang B ay breathing. So, sa breathing naman, makikita natin yung doon natin, kung meron, humihinga pa ba yung tao o hindi na. So, paano malalaman kung humihinga pa ang tao o hindi na? Tingnan natin ang pulso. Titingnan natin ang pulso, maybe dito sa liig or dito sa kamay. Letter C ay circulation o check for any external bleeding. So, titingnan din natin kung meron nagdudugo sa kanyang katawan or titingnan natin kung meron ba siyang sugat or sa buo niyang katawan para alam din natin. So, D, disability, mental status, and peripheral nervous system. So, mental status, ibig sabihin kung okay pa ba siya, hindi ba siya okay pa ba yung niya, may ulirat pa ba siya or ano. Then, E, expose the casualty for further assessment and treatment. So, dito muna i-apply natin yung first aid. So, paano natin gagawin yung kailangan nating gawin. Implementations considerations. ABCD is widely used as a general survey mnemonic. Following its use, it should be stressed that A, B, and C may implicate immediate actions before proceeding to the next letter. Ang ibig sabihin ng ABCD is first aid is airway, breathing, circulations, disability, and exposure. Ito yung first approach to assess and treat the patients. This approach is a systematic approach to the immediate assessment, and treatment of critical ill or injured patients. The approach
is applicable in all clinical emergencies. If resources permit along the ABCD pathway, a short medical history may also be taken. However, if resources do not permit, the history should follow ABCDE. In an advanced training, participants can be taught additional schemes and mnemonics like sample, which helps to remember other important elements. Sample is S meaning signs and symptoms. A means allergies. M is medications. P is past medical history. L last meal. And E is event. Next is medication administration. Generally, a layperson or even a skilled first aid provider is not authorized to prescribe or give medication. In some countries, there may be specific medications and or conditions for which a layperson is allowed to administer medications. Ito yung tinatawag na hindi sila pwedeng magbigay ng basta-bastang medikasyon sa isang pasyente. The administrations of a medicine is a common but important clinical procedure. It is the manner in which a medicine is administered that will determine to some extent whether or not the patient gains any clinical benefit and whether they suffer any adverse effect from their medicines. Next, severe bleeding. Severe external bleeding. When bleeding is severe, it can be dramatic and distressing. This bleeding is not controlled. Shock may develop and be casualty, may lose consciousness. Bleeding from the mouth or nose may affect breathing. Example, as we encounter a bleeding person, ito yung mga kailangan natin gawin. Put pressure directly on an outer wound with a sterile bandage or clean cloth or even a piece of clothing. If nothing else is available, use your hand. Direct pressure is best for external bleeding, except for an eye injury. Maintain pressure until the bleeding is stopped. Kumuha ng malinis na bandage or kung wala ka naman ito, kahit malinis na damit or pumunit na lang ng damit dun sa pasyente. Tapos itatali mo dun sa area na kung saan yung may bleeding, nagdurugo. Then, yun nga, itali. Ngayon, kung wala naman lahat ng yun, pwede natin gamitin yung kamay natin to press. I-press na yung pressure natin, i-press natin doon sa wounds para tumigil yung pagdudugo.
Internal bleeding. Bleeding inside body activities may follow an injury as a fracture or a blow from blunt object, but it can also occur spontaneously, for example, bleeding from a stomach ulcer. So dito po, internal bleeding, mas malalaman lang isa po sa reason bakit po natin malalaman na may internal bleeding tayo. Kagaya po nung may ulcer. Yung may ulcer po, nagkakaroon sila ng bleeding sa loob ng stomach nila. Kaya po, pag nag-CCR sila o nagpupupo, yung pupo nila possible magkakaroon po ng itim na dumi dahil gawa ng dugo na sumasama sa dumi. Splinters. Small splinters of wood, metal, or glass may enter the skin. They carry as a risk of infection because they are rarely clean. So, sa splinters po, ito po yung kapag sa mga kahoy or sa mga glass, metals, yung bigla na lang po may tumutusok sa kamay natin o sa balat natin. Nagkakaroon din po ito ng infection dahil hindi po natin kasi talaga siya totally makita kung nasan man naka-direction yung pumapasok po na wood, maliit na wood na matalas. Mas kadalasan po nakaka-encounter po tayo nito sa mga plywood, sa metal, sa mga bakal na na may matutulis. Poisoning. Some poison are man-made. For example, chemicals and drugs, and these are found in the home as well as industry. Sa poisoning po, ito po yung mga gawa ng tao. Kagaya ng mga drugs. For example na lang po natin ito yung drug talaga. Ito po yung mga gawa talaga ng tao. Yung mga sunrocks. Halimbawa na po dito yung mga poison na talagang gawa ng tao po. Na purpose naman po talaga is makatulong. For example po sa gawaing bahay, makatulong na mapalinis yung floor kaya yung inodoro, pero sa ginagawa po ng tao mas tinitake po nila to, or sa mga drugs po na mga gamot, mas pinipili po nila na mas overuse po kaysa sa mga pang purposes lang po dapat. Swallowed poison. Chemicals that are swallowed may harm the digestive tract or cause more widespread damage if they are sent to bloodstream and are transported to other parts of the body. So, swallowed poison po, ito po yung laso na nalunok mo, or yung ma-harm po ito na ma-digest dahil pwede po siyang kumalat sa ibang party ng mga katawan natin. And what to do if the casualty is conscious? Ask her what she was swallowed and if possible how much and when. Call poison control. If the casualty is unconscious, call for emergency. Monitor and record the casualty vital sign while waiting for help to arrive. Keep sample of any volumated material. So, dito sa what to do po, dapat tatanungin natin siya kung kailan nangyari at kung saan po. And dapat po tumawag tayo ng pwedeng tumulong sa atin sa pagdating sa gantong pangyayari para po mas magapan at mamonitor nga po yung vital sign niya habang naghahanap po tayo nag-aantay po tayo ng tulong sa mas nakakaalam. Dito po mas sinasabi na dapat kapag may broken bone tayo, dapat hindi po natin gagalawin kasi mas pwede pong mas malala yung mangyari. Yung may mga skin or muscles po tayo na hindi pa napupunit, pero kapag ginalaw mo pwede pa pong mas ma-damage pa or mas mapunit. Open and closed fracture. In an open fracture, one of the broken bone ends may pierce the skin surface or there may be wound at the fracture site. Sa open wound po, ito yung mga structure na siguro pag na-aksidente, mas mabilis yung mga sinasakyan, kagaya po ng motor example po, na yung pag nag-accident ka, pwede kang lumabas talaga yung mga buto mo. And sa closed fracture po, ito naman yung nababalian lang. So, parang hindi po siya ganun delikado kesa po sa paglabas po ng mga buto. The stable and unstable fracture. The stable fracture occurs when the broken bones do not move because they are not completely broken or they are impacted. So, dito po mas sinasabi na dapat kapag may broken bone tayo, dapat hindi po natin gagalawin kasi mas pwede pong mas malala yung mangyari. Yung may mga skin or muscles po tayo na hindi pa napupunit, pero kapag ginalaw mo pwede pa pong mas ma-damage pa or mas mapunit. Dito naman po burns and scald care when treating thermal burns that are deep or extensive. The longer that burning continues, the more severe the injury will be. So, mas matagal po na magkaroon ng sunog sa ating katawan, mas malala po yung pwedeng injury natin, mas malalang injury yung pwede natin matamo.
Burns and scalds. Small superficial loans, burns and scalds are often due to the domestic incidents, such as the touching a hot and iron of the oven rack. Most of the minor burns can be treated successfully by the first aid and will the head healed naturally. However, you should advise the casualty to seek the medical advice if you are at all concerned about the severity of the injury after the wounds blisters may form. And example ko dito, the wounds of the skulls. And for example, ang hindi maalala pagkasunod ng pagkapaso ng balat, parte ng katawan ay insidente. Ito ay madalas nang yayari ng bahay tulad ng paghawak ng isang mainit na bakal o hawakan ng karamihan ay hindi malalang pagkapaso. Maaring ito ay matagumpay magamot sa pamagitan ng matinding tulong. Ito ay maghihilom ng normal subalit dapat mong payuhan ang nasaktan upang ito ay mabigyan ng tamang lunas kalubhang ng pinsala matapos ng pagkasunog. Special case blisters. Never burst and blister is the usually need to treatment. However, if a blisters break or is the likely to burst, cover and with a non-adhesive sterile the dressing that extend will the beyond the edges of the blister. And then may example ako dito about the blister. Like example, pagkakaroon ng paltos ang dahilan na ikaw ay nagkayapak ng or pagsuot ng hindi naman wastong sukat ng sapatos. Ito ay dahilanan ng ikaw ay pagkaroon nito. Ay ang paltos ay ito ay hindi na kailangan ng kahit anong medical or medisina. Fainting. Fainting is the loss of the consciousness caused by the temporary reduction of the blood flow to the brain. It's the maybe is the reaction to faint, exhaustion, lack of food, of the emotional stress. It is also common after the long of the physical inactivity, such as standing of the sitting, especially in the warm atmosphere. And then ito, may example ako about din sa fainting. Kahit sino naman tayo magkaroon yan dahil kung hindi natin pag-isipan ang ating yung katawan natin, ito ang ang importante ang diyan tayo nagkakaroon ng ang pagkahimatay na ay hindi labis ng pag-inom ng tubig na kailangan ng isang tao. Ito ay magdudulot ng pagkahilo, ng pananakit ng ulo at panghihina ng lakas o panlalambot ng katawan. Dahil nga mahina nga tayo minum. Kailangan nga tayo sa katawan natin ng tubig ng tao. Ang pag-iinom ng tubig ay importante lalo na kung ang tao ay nasa labas ng bahay. Nasa tirik, lalo na sa mga labas ng bahay at siyempre tumitirik ang araw, ay kailangan dahilan talaga ang pagtaas ng dugo. Ayun. Thank you. That's all.